This case presents the problem of an adult who experiences unstable tachycardia. Unstable tachycardia is defined as an elevated heart rate accompanied by one or more of the following signs and symptoms: chest pain, shortness of breath, decreased level of consciousness, hypotension, shock, pulmonary congestion, congestive heart failure, and AMI. When treating a patient with unstable tachycardia, emphasis should be placed on rapid assessment of unstable tachycardia and identification of the rhythm, synchronized electrical cardioversion, and post-cardioversion monitoring. Unstable tachycardia can result from a number of tachyarrhythmias, such as ventricular tachycardia, paroxysmal supraventricular tachycardia, polymorphic ventricular tachycardia, such as torsade de Ponce, and atrial flutter or atrial fibrillation with a rapid ventricular response. Skills needed for successful performance in this scenario include assessment of unstable tachyarrhythmias and diagnosis of rhythm, synchronized electrical cardioversion and assessment of the patient, and proceeding to unsynchronized cardioversion from synchronized electrical cardioversion.
Now, these are the
We will now see an emergency situation involving a patient who experiences unstable tachycardia.
particular project.
Yeah, I've been having trouble breathing today and feeling pressure in my chest. And this afternoon I just have been feeling really exhausted, and I feel like my heart is just racing.
Let me get you to an examination room right away.
The patient's symptoms, palpitations, difficulty breathing, severe chest pressure, and weakness all indicate a hemodynamically unstable situation, which should be assessed and treated immediately.
Mr. Jackson, I'm going to listen to your lung sounds. I want you to breathe normally for me.
When you're putting some oxygen on your face, this mask might get a little uncomfortable, but try to bear with it. He has a V-tach rhythm. His pressure's 74/50 and his heart rate's 190. His respirations are running around 24.
He has bibasilar rales, and his skin is cool and clammy.
I'm going to go ahead and establish IV lactated ringers and get labs and lights per protocol. If you could put that on the other side for me. So you're going to have a tight rubber band over here on your arm.
Mr. Jackson, we're just changing the sides of your blood pressure cuff.
The first priorities in treating patients with tachycardia are administration of oxygen, obtaining IV access, and hooking the patient up to a monitor. Once these procedures have been completed, electrical cardioversion is indicated in patients with tachycardia accompanied by serious signs or symptoms. If the patient has a ventricular rate greater than 150 beats per minute, cardioversion should be performed immediately. Immediate cardioversion is generally not needed for rates less than 150 beats per minute.
Hi, Terry. What's his current status?
This is Mr. Jackson. He's a 45-year-old gentleman who presents to the emergency room complaining of difficulty breathing, chest pressure, and weakness. Right now he's in V-tach, and his blood pressure is 74/50 with a pulse of 190.
What's his current oxygen saturation?
His current oxygen saturation is 94%, and that's on 15 liters via partial rebreather mask.
Mr. Jackson, I'm Dr. Parker. How are you doing, sir? Do you have a heart disease, sir? You take the Jackson? You have any allergies? He's getting out of it. I'm going to go ahead and listen to his chest. Terry, we're going to need to shock him. Can I have an intubation tray and suction ready?
Intubation and suction are ready. Do you want synchronized or unsynchronized cardioversion?
We'll do unsynchronized. We'll start at 100 joules. Mr. Jackson, can you hear me? Mr. Jackson, we're going to try and slow down your heart. It's beating too fast, okay?
Would you like for me to sedate him first?
No, he's barely with it, and his blood pressure is too low.
Stand clear, shocking. All clear, shocking. He's converted to a normal sinus rhythm, the pulse of about 99. But I'm getting a lot of PVCs.
Oh, his pulse ox is 98% now. And here's these labs if you want to take a look at those.
Oh, thanks. His electrolytes are normal. That rules out hypokalemia and hypomagnesemia. So let's administer lidocaine, 1 milligram per kilogram body weight IV bolus, and we'll follow that with a maintenance infusion of lidocaine, 2 milligrams per minute. And could you kindly check his blood pressure and respiratory rate? Terry, also, could you kindly order me a 12-lead EKG? Okay. Thanks. Mr. Jackson, how you doing, sir?
I'm feeling better now.
Oh, that's good.
His respirations are still 24, but they're not as labored. His blood pressure is now 122/74.
Lidocaine has been administered.
Continue monitoring his vital signs until it stabilizes and watch the monitor for any arrhythmias. And in the meantime, we'll get him ready for CCU admission.
Following successful cardioversion, it is important to check the patient's respiratory status, cardiovascular status, and neurological status. Some common errors in a situation like this include failure to resynchronize the defibrillator as necessary, failure to turn off synchronizing circuit for non-triggering rhythms or poorly perfusing VTs, inability to rapidly identify the stability or instability of the patient's cardiovascular system, failure to follow up with a history, physical, and identification of the possible cause of the arrhythmia, treating the monitor instead of the patient, and failure to provide antiarrhythmic therapy after electrical cardioversion of the patient with VT.